The information shared on the Sky Women's Health podcast is for educational and informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding your medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Reliance on any information provided by Sky Women's Health, Dr. Carolyn Moyers, or any guests featured on the podcast is solely at your own risk.
You're listening to Sky Women's Health Podcast, your evidence-based resource for women's health and wellness, exploring the holistic principles of osteopathy, integrating mind, body, and spirit, designed to empower you as your own healthcare advocate and help you live your best life. I'm your host, board-certified OBGYN, Dr. Carolyn Moyers.
Welcome back. Welcome to Sky Women's Health Podcast. I'm so excited that you're here with me today. We are talking about an important topic with Dr. Nisha Patel. If you don't know her, she's Dr. Plantel on Instagram. She is an internal medicine physician focusing on cardiometabolic health. Explain to us what that means, Dr. Patel. Welcome to the podcast.
Thanks so much for having me, Dr. Moyers. I love cardiometabolic medicine, especially for women across the lifespan. So you can think of it as like the intersection of heart disease, diabetes, obesity, high cholesterol, all of these medical conditions that often have common pathways of development, often occur together. And what we often don't talk about in women's health is how this risk varies through the lifetime. And it varies based on the stage you're in, like what your past history is. And it is like my entire life's passion. And I'm just like so excited to keep digging. I mean, I'm like a total nerd when I read articles and learn more things. It's like, I mean, you get it. It's just, yeah.
Total like in my DNA.
It's like all I know. Like, what do I do it for fun? I learn.
Same. I'm like, maybe I need some hobbies, but yes,
I know.
I totally get you.
I moms, and so like those are. I mean, that's just enough of a like. Yeah, there's you know.
Yeah. Kids and learning, like that's it.
Yeah, kids and learning.
Okay, so I love that, and I would love to talk to you about the cardiometabolic aspects as well because that's so incredibly important, especially for women in midlife. And my population is mostly 30 plus, as we're going into that menopause transition. Which we have a higher blood pressure and higher cholesterol panels and all that. So incredibly important. Yes, and increased insulin resistance, absolutely. But today we're here to talk about your story, and it is Cervical Cancer Awareness Month. And I think that it's very important for us to bring a light to the importance of screening of HPV vaccines. And also, just because you may have had normal Pap smear screenings and you think, oh, I only need this every 3 years or 5 years. Great, I'll see my gyno then. And you don't go in, what can potentially happen in that year between? I always tell patients, you are more than a cervix. You're more than cervical cancer screening.
More than a uterus. Yes,
you're more than your uterus. Please, let's see the doctor. So tell me a little bit about your story.
Yeah, so I did share this story to social media, and I had gone back and forth about whether I wanted to share this because this is really personal. But I decided that it was interesting because I decided on the last day of 2025 that I had to share this because I don't want another woman to face what I had to face or, go through what I had to go through. And I hope that my story will help people understand the importance of screening for HPV, the HPV vaccine, having that relationship with your OB-GYN or whoever does your Pap smears. So I'm a physician, obviously. And, you think that physicians are like great patients, but sometimes we're not the best. So my story started in the early part of 2025. I actually found out that I was pregnant unexpectedly. My husband and I, we wanted additional children and we were like thinking about it. And then was like, oh, you're pregnant. And it was like, whoa, okay, this is really great. Let's see how this goes. But unfortunately, that pregnancy ended in a loss. I had a miscarriage a few months later. And, as a physician, I just wanted to make sure that, hey, let's make sure that this miscarriage is completed. Like, I do want to have children in the future. And I really want to make sure everything's okay. So I asked my OB at that time, like, hey, how do we kind of, monitor for making sure that the miscarriage is completed and that I can get pregnant again down the line? And they said, okay, we can follow some blood levels of your beta HCG. I was like, do I need an ultrasound? They were like, well, we can see, depending on your blood levels. And I thought that was, obviously a reasonable answer, but something in my gut, I don't know what it was, told me that I should make an appointment and go in and get an ultrasound to see if my miscarriage had completed. So I did with another one of my colleagues. And as she was doing the ultrasound, she like looked at me and she goes, did you know you have some lesions down here that really don't look normal and need to be checked? And I looked at her and I was like, lesions? She was like, have you had itchiness? And I was like, I mean, I think a lot of women have itchiness in their GYN area. And I didn't think much of it because I was, let's see, it had been kind of pronounced. I was postpartum with my son. And when you're a mom, you don't let anything slow you down. Like, you could literally be hit by the plague and keep going. So I was like, whatever, I'll like deal with this later. And so I looked at her and I could see this look on her face that was like, you need to get this biopsied. And I was like, why is she freaking out so much? And she literally looked at me and was like, on your way out, schedule your biopsy. And I was like, I didn't quite grasp the severity of like what it was or what it could be. And so it ended up that I didn't have a complete miscarriage. And so I had to have a hysteroscopy, which is a procedure where they take out the retained tissue. And at that time, I had a biopsy. Again, I am not thinking anything is going to come of this. I'm like, okay,
Sure.
I don't know. Maybe it's dry skin. Who knows?
Right.
And so then I was
And
at
there
a,
are vulvar skin disorders, right? So there's
yeah,
so many things that it could potentially be.
yeah.
And can I just ask, was your pap smear up to date? Had you had the HPV
Yes. Oh my
vaccine?
gosh. So my pap smears have been up to date. However, I did not get the HPV vaccine when I was younger because at that time, the guidance was that I had tested positive for a low risk HPV. And they told me that, oh, well, you've already been exposed. You could get it, but you really, at this point, it doesn't really matter. And I remember looking into the pricing actually, and I had like crappy student medical insurance. And it was just like, I don't know, I forgot. It was like several $100s. And at that point, that was just way too much for me. And, I wasn't
Right.
like, I was supporting myself. And so I didn't end up getting it. But I
Yeah.
did make sure that I had all my screening after, PAPs all after that were normal.
Yeah.
And even the PAP that I had, what was it, 6 or 8 weeks postpartum with my son, which that was normal.
Mhm.
And the thought was that, not to like jump to the conclusion, I'm sure people are wondering, what did your biopsy show? Well, I was at my friend's wedding and I got a phone call from my colleague and she's like, have you seen your biopsy results? And I'm like, no. And she was like, you have VIN3, which is vulvar interepithelial neoplasia type 3, which is the step before it becomes vulvar cancer.
Right.
And I'm
High
like,
grade
what?
precancerous condition.
Yeah.
Mhm.
I was like, what are you talking about? I just like, it did not register. And I was literally like, I think like any person, then you start Googling and then you're on ChatGPT and you're like, wait, what does this mean?
Yeah.
And I found out that it was pretty rare to have that, especially now in the face of having, the HPV vaccine. And that even then it's even rare. And I was just shocked because I had a normal pap smear like 6 to 8 weeks after I delivered my son. And the thought was that I've always had been harboring this high risk HPV, but it reactivated in the setting of pregnancy and stress.
Sure. Right. Where your immune
Yeah.
system is slightly depressed.
Stressed, yeah. And like I was postpartum, I wasn't sleeping, we're not taking care of
Sure.
ourselves. Like
Sure.
we're so stressed out. And because I don't have any of the other kind of risk factors. Um, and I've never tested positive for a high risk HPV before. And so
Yeah.
I was just shocked. So I had to have surgery and everything's fine and good and all that. But it just, it just makes me infuriated because there's so much like misinformation around HPV screening and vaccinations right now. And it's like, I wish somebody had pushed me to get this vaccine
Yeah.
and it
Yeah.
had been covered. I wish that I had known better. Like, I regret that
Entiendo.
decision. I did subsequently get vaccinated to boost my immunity to help clear this HPV. Because I mean, I'll do anything at this point to really, reduce my risk because my risk is not zero. It's not like this can never come back. It could. And, but now I know about it and I know what to do about it. But it's just, it was nuts. I mean, I still look back on that year, 2025, and I was like, did that really happen? It did.
So I'm so sorry that that happened to you.
Thank you.
One of the things that I love to recommend for patients who it's not affordable, right? Because I
Mhm.
got it as, again, same age category where it was like, yeah, not really an option for you. I was over age when it came out, which
Yeah.
the
Same.
HPV vaccination is recommended in young girls, even starting age 11, 12,
Mm.
and boys, let me say, boys and girls, age 11 and 12 up to age 26. That was the initial recommendations. And so I fell out of that as well. But then when they extended the age recommendations to age 45, I was like, oh, cool, sign me up. Not really any health risk factors, but I like to practice what I preach, right? And when I tell patients to do that. So I went ahead and got the HPV vaccine. And I know my husband was like side eyeing me, like, what, really? But, hey, reduce any risk.
Yeah, because it's
um,
not like HPV doesn't like one of the other OBs was like, they don't break up homes. It's like, it's the fact that like it is ubiquitous in our
yeah,
environment and many
yeah,
women don't have trouble from it. And unfortunately, some do.
right, absolutely. Okay, so and it did cost a couple $100. What I always recommend for my patients is go to the health department. If
Oh,
you can't
yeah, that's
afford it,
great.
go to the health department. Like, let's make this easily accessible. And to your point of having normal screening and then having this come up like out of the blue, like, hey, something's unusual here. So you were having a transvaginal ultrasound. And generally, we're not paying close attention to the vulva when we're doing that, right? We're just placing the probe and then the sheets over. So the fact that your OB recognized it is really fantastic that she recognized it and she brought it up. Speak up, right? So yeah, people tend to be really resistant to doing vulvar biopsies, but I am like, mm-mm. If there's something abnormal, if we've been chronically itching, if there is a reason, I want to know the underlying cause, right? And so I have Pronox in my office to keep patients comfortable as well, but if we're having chronic itching or burning of the vulva or itching and burning that comes over a period of time and doesn't go away, if you're having some bleeding that's not related to your menstrual cycle, if there's a change in color to the skin of your labia, or it's becoming more red or more pale, if there's changes in the surface of the skin, texture and rash, warts, sores, thickening of the skin, we want to biopsy, especially if there's
Mhm.
a lump or a tender area on the vulva. So we want to make sure that we're not missing anything that's obvious. While vulvar cancer and vaginal cancer is rare, it's not zero. And we
It's not
know that
0.
it's related to HPV exposure, and majority will be exposed to HPV in their lifetime. And like you said, the body usually clears the human papillomavirus, but in times of stress and times of
Mhm.
decreased immunity, we're going to see that present again. So you're more than a cervix. It's important to get your annual exams. Don't
Yes.
go 3 to 5 years between your annual exams just because you don't need a pap smear, because you are so much more than cervical cancer screening, and I think that this really highlights that.
Absolutely. I am so grateful to my colleague that she looked and made me do it basically because, I think as doctors, again, this goes back to what I was saying earlier, we're not the best patients. Sometimes we just want to like shove things under the rug and be like, yeah, I'll deal with it later. But had I done that, had I delayed it, I could have gotten cancer and I could have had a very different outcome.
Yeah, absolutely, absolutely. It may be your 2nd, 3rd pregnancy down the line, right, where you're like, "Oh, hey,
Yeah.
something doesn't look right here,
Exactly.
maybe
Now
you should."
I'm very cognizant of it and I'm just like, okay, I'm gonna get checked. And like we have a plan right now with my OB and but it's like had I not known that, like I wouldn't have been able to get treated and have a plan to prevent, hopefully, the recurrence, or at least if it does recur, get treated early.
Yeah. Yeah. Are you comfortable talking about your treatment and what they did? Did you have laser or resection?
I had a resection, and thankfully it was in a way that this could be very debilitating for women depending on what type of resection they're having. A lot of women don't talk about it because it's such a sensitive topic. But
Sure.
thankfully, it was a very minor surgical procedure and they were able to resect it and everything's fine. But I mean, when you look I read a lot on the forums, and I mean, it's devastating to think about what women go through when they get vulvar cancer. I mean, some patients have to have really extensive surgery, and it's not easy to go through that. When I shared my story, I had many of my followers in my inbox actually saying, "Thank you so much for sharing it. I've been so ashamed of this my entire life." And that's so sad because it sucks. That they felt like they just had to hide it and suffer in silence. And that's something that I promised myself that I would never do. If there was something that could help somebody else, then
Yeah.
I feel like I have the voice, the platform, and the
Yeah.
privilege to be able to share those things. It's not easy. Like I said, I waffled back and forth. I was like, do I share this? Do I not
Worse.
share this?
I know.
But
I
I
can
felt
just
like
see you just sitting there do I push this?
I know, but I pushed it and I was like, okay, it's done.
Out there.
It's out there. And I mean, I don't want anyone to go through this. I mean, after I got diagnosed with BIN3, one of my colleagues told me that their family member passed away from vulvar cancer. They didn't tell me that when I was going through the treatment. Told me
Yeah.
afterwards, and I'm like, no, there are women still dying of this cancer.
Yeah.
And I mean, if please do not
Yeah.
ignore your skin down there. Don't do
Exactly.
it.
Here's a mirror. One of my best tools in my office is a large mirror that I bought off of
Yes.
Amazon. And we use it a lot for sexual health, but a lot of times it's just at the annual exam where I am giving patients a tour of their vulva. Like,
Yeah.
here is the clitoris, here is the clitoral hood. Here, we kind of walk through, oh, here's the changes I'm seeing to the labia majora and minora. It's so important to just take a gander every once in a while. Ladies,
Yeah.
just
Just take a
get a
look.
mirror, take a look. Is there anything that's changed? Um, yeah. Yeah, I think that's so important. So I'm wondering if anybody brought up to you the AHCC supplementation to support immune function to clear persistent HPV.
I have heard about it from one of my other colleagues and a good friend. I was trying to do some research and figure out dosing, and I forgot if she said it was from mushrooms or something. I can't
Yeah,
remember.
yeah,
Yeah.
yeah. It's
Yeah.
mushroom extract. Yeah, yeah, yeah. So it's something that a lot of my patients are using if they've had persistent HPV. It might be worth looking at. I don't think it's any
That would
harm.
be
You would
great. If you
obviously
haven't
have to talk to your OB.
No. Yeah, I wouldn't do it now, I think, and partially I had heard about that, and then I was like, "Oh, maybe I'll start this," and then I was like, "Wait, I should probably wait till I'm done, being pregnant."
And so I think that as we talk about this, it's important also to point out that you're a physician, you
Yeah.
are all about eating your plants and moving your body and all of this. Like, you were doing all the lifestyle measures. So I think so
Oh, yeah.
often we like to blame ourselves. Women like to take
Mhm.
on the blame. Like, what did I do to cause this? Or you might assume that you were living an unhealthy lifestyle, or you were smoking or something
I
of
know,
that.
yeah, or
All this
yeah, I'm smoking or no, and I wasn't, and so it's just I think there's so much stigma and blame. I mean, but yes, that was kind of a big point that I was making is that you can do all the things right and still get sick or still get a disease, and that is not a failing on your part. That is, unfortunately, the reality of what it is.
Yes.
Yeah.
Yeah, 100%. I don't think we can have this conversation without just reinforcing the recommendations for cervical cancer screening according to American College of OBGYN and the USPSTF recommendations. I know that the American Cancer Society recently came out and said 25 and up, age 25 and up. ACOG has yet to update that or to change that recommendation, but we start Pap smear screening at age 21 to
Mhm.
29, and that's when it's every 3 years, as long as it's normal. These recommendations do not apply to anyone who has high risk of disease or has had a high risk precancerous lesion. Okay. And then age 30 to 65, it's every 3 years. If we only do a PAP, if we do a PAP plus HPV testing, that's what we call co-testing, then it could be every 5 years. In my practice, I do it every 3 years because patients tend to be transient, and had they had HPV along with their PAP or not. I think everybody practices a little bit differently. And then 65 and older, I think it really depends on risk factors, right? Because
Mhm.
they're living longer, and somebody may be in their divorcee age, or they may be widowed and now dating again. And I don't think
Mhm.
that's somebody that we just need to ignore HPV screening on. Um,
Absolutely.
and there's also the at-home testing for HPV now, which is actually very, very specific. I don't know if you're familiar with this.
I've heard about it. Yeah, I've heard
Right.
about it, but I haven't
So
ever tried it.
it's only for those. I think it really applies to areas where individuals have limited access.
Yeah.
So it's great because they could self-collect, right? But this is just a swab for human papillomavirus. It is not a swab of the cervical cells. And as your case points out, very importantly, an exam is often
It's
needed.
crucial.
It's so
Yes.
crucial. So, too often we've treated the vulva as like curtains on the way to the big show, which was the pap smear. But, we really have to look at those vulva as well, because there are skin disorders and skin lesions and precancerous things that can occur on the vulva. So I think that that's so critical. But it's only for women who are 30 and older who have not ever had an abnormal pap smear. Like, they have to fit into a very specific criteria to do the self-collected testing. And then if it's abnormal, they need a follow-up exam, right? And
Yes.
so, it's just so important that they still have that relationship with the physician. But
Oh, 100%. Because like, after I got diagnosed, with VIN3 and it came back positive for high risk HPV, I was like, "I need you to look everywhere again." Like, just look everywhere. Like, I got another pap smear, like, I wanted to make sure that I didn't have, cervical changes. I got colposcopy, like, I just you
yes.
can never be too safe, like, and, I thankfully didn't have any of those other changes, but it's frightening, You're like,
Yeah,
"Where else is this causing me problems?"
sure. So let's talk about what a colposcopy is, and I would love to hear of it from your perspective, okay? So a colposcopy is a detailed exam of usually the cervix, right? But we do colposcopies of the vulva, of the vagina. That's all included. So basically, we're looking at the female anatomy with a microscope,
Mhm.
often applying acetic acid, because those abnormal cells will kind of soak it up and
Light up,
dehydrate and
yeah.
turn this bright white, and it makes very visible what needs to be biopsied. What was that like on your end?
I didn't really have to, like I wasn't awake during it because it was actually at the time of my hysteroscopy, like,
Oh, so
um,
nice. Yes. Colpo
uh
under anesthesia, please.
I know, it was a colpo under anesthesia, so well, I take that back, sorry, it was at the time of my, I'm like, Who did what?" Sorry, I misspoke. Um, I didn't have to be awake for it because I was under anesthesia for my, the vulvectomy, the partial vulvectomy, and so she did it at that same time. So I had no idea, like, what it felt like or anything, but thankfully, like, there were no changes. I think she took some biopsies and everything was okay. But I just was like, "Gosh, I hope there's not anything hiding on my cervix too," because I've had friends that have had, cervical intraepithelial neoplasia type 3, and it's obviously very concerning, and I, as a physician, I'm like, "I know where HPV can hide and cause problems." So we had it all checked. Yeah.
Yeah, yeah. But that time frame of, waiting for your diagnosis and undergoing your treatment, and is it gonna come back? Like, that really takes its toll on you, I'm sure.
Yeah, it was hard. I mean, I was like I think what helped me is actually this is like I just worked, because I didn't wanna think about it. Like, I had a toddler, I had, my career and my patients and my family, and And it did help me, but I think what also helped me is talking about it. I didn't, I wasn't like shouting it from the rooftops at that time, but I was not hiding it because it was a part of my life. And I um hoped that sharing it could help other people. That was my whole point of doing that because of just how crazy this entire story is. I look back and I'm like, did that really happen? It did. Yeah.
Yeah, yeah, and now you're pregnant with your
Yes.
second
My
baby, is that
second.
right?
Mhm.
Yeah.
Yes, we are so excited, and I am very cognizant of any changes. And the OB that diagnosed me with VIN3 is she's the one I've been primarily seeing, and so she knows my history, and we have a plan on making sure that like things don't recur and all of that.
Yeah, yeah. So let's just kind of wrap this up in terms of, I mean, this is your life story, and I do not want to be insensitive to this at all, but I also want to be respectful of your time. And I know you have
Mhm.
additional meetings to get to.
That's
So
okay.
I could talk about this all day. So VIN3, so that is graded by the number of atypical cells that they see under the microscope, right? And if anyone has persistent itching or pain or burning or noticeable changes to their vulvar skin and color or texture, it's so important that you get a clinical exam. The diagnosis is made by biopsy, like we were talking about, doing the colposcopy or exam with the microscope and biopsying any areas that are concerning. And, the VIN stands for vulvar intraepithelial neoplasia, and it's graded in a 1 to a 3. And this is a precancerous condition. So it's not yet cancer, but
Thank God.
it can be higher, right? And so it's so important that we get it treated early. I'm curious what your biggest takeaway would be to someone listening today.
Well, I feel like I have multiple. So,
Yeah.
always practice as healthy of a lifestyle you can, but please seek medical care if you have a concern. I hope that my wish is always that you find a physician or a provider that you have a good relationship with so you can have those honest discussions. Number two is that please do not, if you're eligible for the HPV vaccine, please, it can prevent cancer. It could have prevented this from me potentially. Um, had I gotten it earlier in my life. And it, like I said, it's one of my biggest regrets for not getting it.
And we do know that there's some cross reactivity. So just because you've been exposed to one HPV
Yeah,
strain does not mean that it wouldn't be effective for you against other HPV strains.
yeah,
So, yeah.
absolutely. Um, and don't skip your pap smears and screening. Please don't do it. Also, advocate for, most OB/GYNs, they do a skin exam, but if for some reason that didn't happen, like you can just gently remind them to, hey, can you just take a look at my skin and make sure there's no abnormal lesions? Because again, this wasn't an area I could not see. Um, and so I'm so glad that I went in and got that ultrasound because I don't know what else would have happened had I not.
Yeah, I mean, one thing that I'm hearing from you is like, the recommendations that you were given were very appropriate, right? No, you didn't have to have an ultrasound to confirm that
Mhm.
the pregnancy had completed on its own. You could have followed your beta HCGs down, and then if it didn't, get an ultrasound, So, like, all that is appropriate, but you trusted your gut.
It
You
was my
listened to
gut.
that little inner voice that was like, something doesn't just quite feel
Mhm.
right. And so, thank God you did. So, I think getting a second opinion or asking or advocating for yourself, like, I think there's something more here. Maybe we could like, I love to tell patients, I may be the expert in this realm, but you're the expert on you.
Yeah.
Right. And so I need you to fill me in when you're like, no, this does not feel right to me.
Yeah.
I think that's such an important message. So bravo for advocating for yourself.
Yes, that's the one thing I think that, I wish more women, felt empowered to do or felt comfortable doing, I should say, because, our system, it's not perfect. And historically, many women have unfortunately, felt like they had their concerns dismissed or not
Sure.
felt heard. And I mean, don't ever stop advocating for yourself. I mean, and I was so grateful to all of my colleagues. I mean, they were all amazing. And I again, it's privilege, right? Because I'm a physician and I have those relationships, but I know not everyone does. And so
Yeah.
please don't stop advocating for yourself.
Agree. I mean, friends, it wasn't until 1993 that women and minorities were required to be in research studies. I mean,
Yes.
can we just grasp that? Like, we
Yeah.
as women have to band together and really advocate for each other and for ourselves because we can't wait for
Yeah, we can't wait.
can't
We
wait for
can't.
somebody to do this for us. It's not
Yes.
happening. It's not happening. I think women getting loud and proud is why perimenopause and menopause is having a movement, right? Women are like, I'm not taking this sitting down. I want the data. I want to know what's happening to my body. So thank you, because I know that this is not an easy topic to discuss. This is very personal. Nobody really likes to talk about their lady bits and what's going on with their vulva. You know, a lot of women don't even love whenever I pull out the mirror. They're like, "Oh my God, you're going to show it to me." I'm like, "Yes, I am." All vulva come in different shapes and sizes, but if there's anything that is different on your personal exam, if you're like, "Oh, that, you know,
Feels odd.
that
Yeah.
was odd. That hyperpigmented area, that wasn't there before. What's going on here?" Do not hesitate to ask. And if you don't get an appropriate answer or you feel dismissed or that your concern is poo-poo, then please seek a second opinion.
Yes, absolutely.
Well, thank you so much. It's been such a pleasure. And I would love to have you back to talk about cardiometabolic health.
Yes, absolutely. That is my other passion, my huge,
Yes.
huge passion. So thanks so
Yeah,
much for having me on.
absolutely. Until next week, be well.